Since mid-December 2014, the Washington Department of Health has reported 6 cases of ocular syphilis, or syphilis of the eyes, causing blindness in at least 2 patients. 4 of the cases occurred in King County, while the other 2 were from elsewhere in the state. All 4 of the recent King County cases occurred in men, 3 of whom identified as men who have sex with men, or MSM, the group most affected by syphilis in King County. 3 of the cases were HIV infected, though 2 were not receiving HIV medical care. 2 of the cases were sex partners and presumed to be epidemiologically linked, prompting health officials to issue advisories for healthcare providers and the gay and bisexual men population. All of the patients presented primarily with visual complaints, a combination of loss of vision, floaters, a blue tinge in vision, flashing lights, and blurring of vision. Eye exams revealed uveitis with variable retinal involvement. 3 of the patients underwent lumbar puncture, all of whom had CSF pleocytosis, and 2 were positive for CSF VDRL. 3 of the patients were admitted to the hospital for intravenous penicillin. However, 1 patient has so far refused treatment, and public health and medical authorities continued to try to encourage this man to accept therapy. Syphilis is common in MSM in King County, particularly among HIV-infected MSM, in which there's about 3% that acquire syphilis each year. The exact cause of this cluster of cases of ocular syphilis is uncertain. Some evidence suggests that some strains of Treponema pallidum, the bacterium that causes syphilis, may be more likely to cause central nervous system disease. It is not known whether some strains of T. pallidum have a greater likelihood of causing ocular infections, but the current cluster of cases raises this concerning possibility. King County Public Health offers the following advice for sexually active gay and bisexual men who are not in mutually monogamous relationships. A. Use condoms and limit your sex partners. B. Be aware of symptoms of syphilis and other sexually transmitted infections. C. Get tested for syphilis if you experience any of the vision problems I mentioned. And D. Get tested for sexually transmitted infections, including syphilis and HIV, at least once a year.